Okay, so now let's go through the motions of hanging up those primary IV fluids, secondary fluids, and given an IV push medication. Again, this is just going to be a general muscle memory, going through the motions of the process of it, not going through all the safeguards you would have medication specific. But remember, anytime that you're administering any medication, including IV fluids, understand the implication, understand why they're getting it, know what the compatibility is if you're given a primary and a secondary together, know if they can mix together, go through all those patient rights checks and all those things that you would do. Assess your IV site, make sure it's patent, and all that before you start. So, but we're just going to talk basically about how to prime the tubing and get it started, how to administer the secondary medication, and same with the IV push. Okay, so first up, let's talk about the primary IV fluid. So right now we're going to go with that we're going to be giving, we're going to, like we always do, check that we have the right solution. Today we're going to be giving D5.5. So that is what we've got here. We are going to hang it up so that we can get it started. We need our primary IV lines, our primary IV tubing. Okay, and so I've got that here. So again, we're going to maintain aseptic technique for everything we do. First up, we're going to clamp off this tubing before we spike it. We're going to clamp it. It makes everything easier. It makes it easier to get the bubbles out. Okay, so we're going to be maintaining aseptic technique and keeping the tips of everything clean. So we're going to pull this plug on here. Some of them are harder than others. And then, so this is sterile right now underneath here, so we don't want to touch it. I'm going to pull the end off of our primary tubing. Again, this tip is clean, it's sterile. So not just clean, but sterile clean. So now we're not going to touch them to anything else except for each other. So just carefully, I'm going to try to turn it so you can see, carefully going in through here, and then just twist it to gain access there. Some of them, it is like, takes them back, takes some extra strength to get it in there. Okay, so next up we've got our drip chamber. So we're going to squeeze that till it is just about half full. It is not like 2/3 to a half full or 1/3 to a half full. There's not a magic place where it has to be at, just around halfway. That's going to tell us we can see, we don't want it full, okay? Because if it's all the way full, would I be able to tell if this was dripping or not? No, I wouldn't. So now what am I going to do? Easy peasy. These things work great. So if your drip chamber, if you do accidentally squeeze too much in your drip chamber, you want to be able to see it dripping. So this isn't going to work. But all you got to do is take it, flip it upside down, and squeeze that air, squeeze some of that back into this bag, okay? So now we're back to about halfway. I might want a little bit less. Okay. All right, so now I've got my drip chamber back how I want it to be. So don't freak out about it. If pretty much, as long as you don't contaminate the line, pretty much anything else can be dealt with as far as when you're starting your IV fluids. But so don't panic if you do something wrong. We can fix it. Okay, so now what we're going to do is get the air out of the line. So we're going to open up our line and watch the fluid fill up until it's going to go slow because I'm holding it up high. And remember, this is working by gravity. So if I'm holding it up higher than my line, it's not going to want to drip. As soon as I dropped it down low, you might see the drip chamber. As soon as I held it down low, it quickly released. So now I've got my line all the way cleared. Okay, so if I'm going to start this on my patient, I'm going to just turn you towards my patient for real quick. Okay, so as we said, if we're going to start some fluids, we want to scrub this hub. This thing has been laying there. This patient got his breakfast all over it and everything else. It's been sitting up against his bed, getting all sorts of normal flora, bacteria growing all over it. So we're going to clean it really, really good. 15 seconds scrubbing the hub. Again, maintaining aseptic technique. So I'm trying to turn this so that you can see my hands, the way you do this with just your 2 hands. So I've got 2 fingers holding this hub so it doesn't fall down and get dirty again, right? So I'm holding that. So then with the rest of my hand, I'm going to use my pinky and twist off this cap without contaminating this tip. You didn't know you were going to be using every single finger for different things. And then just like we did up there, we're going to make sure that we connect them without touching anything else. And now it's connected. So always before you connect, make sure you've already, as I said, we're just kind of going through the motions. But remember, always flush your IV before starting your IV fluids. Make sure that it is, everything is working good and you don't have any kind of alterations in function of that IV, making sure that it's good and clean and dry and functioning good. So always flushing ahead of time. So, but like I said, we're just going through the actual process of doing it, of what you do to spike the bag and get the fluid through it. Okay, so now let's look at if we're going to give a secondary medication through our primary line. All right, get your supplies together. Things we're going to need is your secondary medication, whatever it is. Secondary IV tubing, and this little hangy thing. I'm sure it's got an actual name. So let's talk about the difference in secondary IV tubing and primary IV tubing. First of all, the length, right? This is pretty short, so like 3 feet long maybe. The other thing that you'll notice, it does have a roller clamp on it, just like your primary does. But your primary line has a valve here. It has injection ports here, and then again down close to our patient, we have another injection port. So that's going to be the difference there. And then depending on what type of a pump you are using, you'll have usually some different type of a mechanism on the primary line that makes it compatible with that pump. For this one, it's this little blue slide clamp. It works, it goes in here. I'm not going to put it in there because it's just loud, and sometimes it doesn't want to stop screaming. So we're going to look at doing this secondary tubing. Okay, so first thing that we're going to do is clamp it. Okay. The next thing, if it is clamped, you can go ahead and do the same as we did with our primary as far as keeping everything clean, but we got it on our hand. Pull it out. Keep everything clean. Using my pinky again and pulling that piece out. Aseptic technique to push this in. Okay, so could I prime this the same way I did the primary line? Squeeze some fluid into the strip chamber and then run it out till I don't see any air. I could, but what's going to happen is whenever you run out of fluid to clear like you do your primary line, you lose some fluid because you're going to be running those bubbles out. So you're going to lose some volume. And remember, this is our medication. This is a medication, an antibiotic, whatever it is that your patient needs to get all of it. We don't want to just administer what was left after we got rid of the bubbles. We want every last bit of this to get into our patient. So what we are going to do is we're going to leave it unprimed for just a minute, okay? I'm going to hang it up. So now comes into play my little hangy thing. So I'm going to connect my primary tubing to the bottom of this hook and hang it up, okay? So remember, just like we talked about with the water, with the air getting out of the line, primary versus secondary is also going to work on the principle of gravity. Whatever is higher is what is going to go in. We want this medication is what we want to be administered. We want it to be what goes in. So to be able to get that to happen, we need it above the primary line. If it is below the primary line is what's going to run. Okay, so we are going to connect the secondary line to the port closest to the IV bag, okay? The secondary line goes closest to the IV bag. We're going to do the same thing we did before. We're going to scrub our hub. Okay. Aseptically connect these lines. All right. So we are now going to back flush this line. I'm going to just lower this down a little bit so I can show you something real quick. Okay. On this line, IV line here, on our primary line, we have here an anti-reflux valve. That means that fluid can go out of that primary line, but it can't flow into that primary line. You'll see on our secondary line, we have no such anti-reflux valve. What we're going to do is we're going to back prime up this line to get the air out of it, but maintain the medication and not lose anything in the process. So what we're going to do, I'm going to try to get this closer so you can see. Okay, I'm going to open up this clamp that's on the secondary tubing. If I lower it below my primary IV, you'll see that primary IV start to drip, okay? You see air bubbles starting, I'm going to lower this a little bit more. Air bubbles starting to come into my secondary line, right? The lower you take it, the faster it's going to fill up because that's the way gravity works. So we're going to do that until we get our drip chamber about halfway full. So just because, so you can hang that down real low. I'm going to actually, it's taking a long time. But so that won't go backwards. If I hold this up higher, it's not going to backflow into that primary bag because of the anti-reflux valve. So I'm going to hold this up higher so that I can get it to go in. Okay, so I now have, I'm going to hang this back up high. I hang this down low. So I now have my drip chamber on my secondary line about half done. Okay? So that way we know that we got the air out, but we didn't compromise our volume from our bag or lose anything in the process. Okay, so let's see here. Other things that we want to look at, it's going to be when we administer this and we'll program it into our IV pump. Most IV pumps are going to prompt you and say, make sure that this is unclamped. Made a little bit of a mess. Okay. Make sure that this is unclamped. There's been a ton of cases, I've seen it multiple times myself, where nurses hang up this secondary bag, but they leave this line clamped. So if this line is clamped and you're running your bag, it's going to run out of your primary bag, not out of your secondary bag. So it might be the next person going to give the antibiotic, they go to hang up the next dose of the antibiotic, and the dose before it is still hanging there. So that can be detrimental to your patient's health, right? So we're going to not do that. We're going to make sure that we unclamp this. Always visualize it Whatever you want to be dripping before you walk out of your patient's room, you should eyeball that and make sure that that is what is dripping at that time. Okay, so let's move on to IV push medication. Again, not going through all the safeguards you go through with all your medication. Make sure you're being specific to your client and to your medication. I'm just going through the process here of how to administer. So first up, we've got our medication we're going to give. Things that we need a syringe, an appropriate size syringe. I'm going to be giving 3 mLs, and I've got a 5 ml syringe, so I could use a 3, a 5, a 10 to be able to do that. We need a micro pen to be able to stick into our vial here. So first step we'll do is get our medication ready. We're going to scrub this hub just like we scrub all the other hubs. We're going to scrub the top. Now, this has already been opened, so it doesn't have that plastic cap on top. Even if it has that plastic cap on top, still clean it. Really good on top. We're going to let that dry. Meanwhile, I'm going to go ahead and get my syringe ready. Got a micro pen, came out of a sterile package. I'm going to keep that end of it sterile. That's going to connect to my syringe. Got my syringe. Same thing, coming out of a sterile package. I'm going to keep that end of it sterile. Connect those two together. Okay. So if you're using a multi-dose vial, just like with your sub-Q and your IM, if you're using a multi-dose vial, you can push it in, push air in. If you're not using a multi-dose vial, you can just pull out what you need. Sometimes you're given the whole syringe. So I'm going to give 3 mLs. I've got a little bit of a bubble in here, so I'm going to try to get rid of that here. Sometimes if you just push it hard into the, there we go, that got it. Okay, so now I've got my 3 mLs. So I'm right at my 3 ml mark. Okay, this is not sharp, this micro pen. Some micro pens are though. There's some of them that are needles, so then don't recap it if it's a sharp. This is blunt. So next up, we're going to prepare to go into our patient room. Supplies that we need are going to be our alcohol swabs to administer. We're going to need a saline flush for before and a saline flush for after we give the medication. After you've pulled up your medication, like I just did, label that syringe. You always, always, always label syringe. Don't carry around syringes that don't have labels on them. So at the patient's bedside, I'm going to push this back down towards my patient's IV site. Again, assessing that site. If they've got primary fluids going, as this one does, then you will choose the port that is closest to your patient to give the IV push medication. If you are not hooked up to, and there's not IV fluids going, then you'll just go directly into that port there. Okay, so we're going to go through this closest port to the patient. So we've selected that port that's closest to the patient. Close off this IV line. We're going to pause it if it's on a pump and close it because we don't want what we're giving in here to back flush up. So first things first, we're going to clean our site. Okay. We're then going to cleanly use our syringe, our saline flush, attach it. We're going to flush that. We want to clear that line of all the medication that's in there. I'm not going to clear it because of this mannequin, but you're going to flush with that. If you are going directly into this hub, you don't need to use quite as much. You could use like 5 cc's versus the whole 10. Okay, So we have flushed. We're going to clean. Got our medication. So we're going to connect. Administer over whatever is prescribed. I suggest you look at a clock, because if there is something that you are given over 2 or 3 minutes, 2 or 3 minutes is a lot longer than what you think. I typically, what I'll do, like this is 3 mLs. If I'm administering that over 3 minutes, then I'll watch the clock and make sure I'm just administering 1 ml a minute. So I kind of split up my volume and think about over how many minutes I want to give it. So do keep an eye on the clock, because I promise you, when you are just slowly given a medication over 5 minutes, that 5 minutes is a lot longer than what you think it is. So take your time and be accurate, because you will hurt your patient if you are not. Next up, so I've given the medication. I'm going to clean. And if this hub hasn't touched anything, if it's sterile, if it's clean, and you haven't touched anything, then it's staying clean. But just be on the safe side, and then we'll clean it again, and then we'll flush again. So flush, med, flush. If you're given multiple medications, it's flush, med, flush, med, flush, med, flush. Start with flush, end with flush. Give a flush between every IV push medication. Okay, and that's it for IV push medication.